Let's take a look in detail, contrasting urgent care with emergency medicine and contrast urgent care with primary care medicine. Setting up the slide, you will see a Venn diagram, two circles with some overlapping yellow circles. Urgent care on the left and emergency medicine on the right. You can see that they are separate and distinct, but they do share a couple of things in common. The first big difference between urgent care and emergency medicine are the type of providers that work in these areas. I use the word provider to encompass both physicians and APPs. Urgent care providers can be trained in family medicine, internal medicine, or emergency medicine, versus emergency medicine providers are exclusively trained in emergency medicine. The next big difference between these two is the scope of practice. The majority of patients seen in the ER are having life or limb threatening injuries and illnesses. These are the patients who are the sickest and most in need of acute medical attention immediately. So, if you think about it, it makes sense that the ER has all the full capabilities of a hospital with all the imaging, labs, medications, and specialists on call to handle these problems. This is different from urgent care in that the patients that we primarily see have minor injuries and illnesses. This means that while the conditions in urgent care that we treat are important, the patients are not usually very sick or extremely injured. The next big distinction is the hours of operation. Emergency rooms are open 24 hours a day, 7 days a week. No matter the time or day, you can receive care in the ER, whereas urgent cares are typically open for extended hours, but not 24/7. For example, the company I work for is open from 8 a.m. to 8 p.m., 7 days a week, and that is pretty typical for other urgent cares. The final big distinction between ER and urgent care is the cost and when payment is required. According to the Urgent Care Association, it costs patients on average $1,600 per ER visit, whereas urgent care costs patients on average $170 per visit. Most urgent care centers and ERs take all major insurances, so that helps with costs. In most cases, urgent care clinics require payment before medical services are rendered, unless the patient is having life-threatening symptoms, such as chest pain, shortness of breath, excessive bleeding, or stroke symptoms. Those types of patients are evaluated and treated before payment is rendered. In the ER, payment is usually made after medical services are rendered. So, what does urgent care and ER share in common? This is represented by the yellow circles in the middle that overlap with each of the separate bigger circles. Both ER providers and urgent care providers take care of acute medical problems. But sometimes, what can initially be thought of as a minor acute problem can transition into a life-threatening problem. This is represented by the red arrow pointing from urgent care to the ER. Let's look at a patient example. A patient comes to the urgent care and tells me that he's been having mild chest pain for the past couple of hours. The patient thinks he may have pulled a muscle while working out yesterday and wants to get checked out. I collect the rest of the history, obtain a set of vitals, perform a physical exam, and obtain an EKG. Uh-oh, EKG shows heart attack. I will then call EMS right away for them to be transported to the ER. So in this example, you can see that what was thought to be a minor acute problem was actually a life-threatening problem. This also shows that urgent care and ER work hand in hand when necessary. Urgent care and ER providers also practice preventative medicine by counseling patients on how to prevent disease and providing vaccinations when needed. Now let's take a look at the difference between urgent care and primary care. Setting up the slide, you will see another Venn diagram, urgent care on the left and primary care on the right. Urgent care providers can be trained in family medicine, internal medicine, and emergency medicine, versus primary care providers are exclusively trained in either family medicine or internal medicine. The next big difference between these two is the scope of practice. Primary care providers primarily see chronic care patients. These are patients who have long-term health conditions that require ongoing management over months to years. Primary care providers establish a long-term healthcare relationship with their patients over many visits and provide continuity of care management. This is different from urgent care in that we see acute care problems. This means patients come to be seen if they have a problem sporadically. I have rarely seen the same patient twice in urgent care unless it is for a follow-up visit. The second big difference between urgent care and primary care is that urgent care has extended hours of operation. For instance, the urgent care that I work for were open 8 a.m. to 8 p.m. 7 days a week, versus most primary care offices are only open Monday through Friday, 8 to 5. One of the things that is shared between urgent care and primary care is prevention. Preventative type medicine includes measures to prevent disease and illness, such as vaccinations, counseling, and screening for disease. So that's the end of the video. I hope this video has provided you more information about urgent care medicine and that you can see urgent care medicine in a different light than you have before. The references that I used are linked in the description below. Thank you for watching, and I will see you in the next video.